I saw a patient this week we did an embryo transfer on that had had 4 previous embryo transfers. She was 42 years old and 4 previous transfers at other centers, which I just figured initially was related to the fact that the pregnancy rate per embryo is lower in 42-year-old women. But that really wasn't the case. She then told me that they had a very difficult time doing every one of those transfers. Some of the transfers required 45 minutes, and the doctors were sweating and having a difficult time. And they thought their speculum was too big, and they tried to use a smaller speculum. They did all kinds of foolish things when they really just didn't know how to do the embryo transfer properly. So you can put all this effort into retrieving eggs, stimulating with hormones, having the laboratory make beautiful embryos from those eggs and the husband's sperm. And then, if the simple embryo transfer is messed up, you won't have a pregnancy. One of the most important things in doing an embryo transfer is to have the patient relax all her body muscles and a reminder of that. And when that happens, the cervix relaxes and the uterus relaxes, and we don't have any difficult embryo transfers then. The catheter goes in easily. It may require some skill, some fine touch, of course it does. But the crucial thing is to have the patient relax her body muscles even if she's nervous. And the next thing is to be delicate about it and not to be foolish and fiddle with different kinds of catheters and different kinds of speculums. It's really a simple process. And this patient last week, it took us less than 15 seconds to do a beautiful embryo transfer, and the husband just remarked he couldn't believe it. It was amazing compared to the difficult transfers lasting up to 3/4 of an hour she had with her 4 previous attempts at embryo transfer elsewhere.